Hello, welcome. My name is Dr. Katz. So today the topic is how to confuse your metabolism. So today we're going to talk about something called calorie shifting diet. In other words, our goal here is to confuse the metabolism. Now you probably haven't heard of this yet, but let's take a look. When you first start a diet, you are eating much less food, much less calories. Your body recognizes that perhaps you're in a starvation mode, and so it begins to reduce your metabolism. As you reduce your metabolism, at first you're losing the weight because you reduce the calories. But the problem is, as soon as you start eating again, you're increasing your calories, let's say back to where they were before your diet, but your metabolism stays slow. And because it's low, you begin to gain more weight. The question is, what can you do about that? So there's a concept called calorie shifting diet. Here's how it works. For approximately 11 days, you eat a low-calorie diet. What's a low-calorie diet? You reduce the number of calories that you eat normally by about 30 to 50%. So let's say you normally eat 1,500 calories. If you go down to 1,000 calories, there's about 33% reduction. You do that for 11 days, and the next 3 days, you eat normally. Now, the word normally doesn't mean eating unhealthy, eating processed food, but it means eating the way you'd like to eat without restricting yourself. Psychologically, that's at least a little bit better. And in fact, if you do 4 days of low calorie, 5th day is normal calories, you at least have something to look forward to. But as far as your metabolism is concerned, the nice thing is that yes, your metabolism will decrease, but it will decrease much less. So compared to a standard diet where your metabolism goes down and becomes really low and stays there for a long time, with a calorie shifting diet, your metabolism really doesn't go down that much. It gets a little bit less, but it doesn't go down that much at all. So the question is, I've had patients ask me, well, what's the difference between this calorie shifting diet and an intermittent fasting diet? So here's the difference. Intermittent fasting, you're basically eating pretty much whatever you want within reason, not ultra-processed foods, but you have a shortened window of time. The typical one is 8 hours of eating and 16 hours of nothing to eat. So you're looking at the clock. The calorie shifting diet, you're not really looking at the clock, you're looking at the calories. So it does involve counting calories and being aware of your calories. The way the calorie shifting diet works is you have 4 meals a day, and each meal is spaced between one meal and the other by 4 hours. Now let's say you're down to about 1,000 calories a day, that's 250 calories per meal, which actually sounds like it's very low, and it kind of is, but if you incorporate more protein, lean meat, some fish, beans, these are forms of protein, but protein keeps you fuller quicker and for longer, so that could help. So the goal of the calorie shifting diet is that you're able to kind of have that nice day when you eat normal. Now keep in mind, having a so-called cheat day, that's not the goal. The problem is you can go for 4 days having low calories, and if the 5th day you pretty much let yourself go, you eat as much as you want, you eat essentially any kind of food, that defeats the purpose. That's not what this is about. But you're able to tolerate the diet a little bit more, and ultimately, as we all know, it's not the diet, it's basically the change in the lifestyle. That's the goal. Intermittent fasting, you're able to eat, again, pretty much what you want, but you have to be careful with the time. And once you get past a certain hour, ideally, you shouldn't be changing that. And in fact, with intermittent fasting, you have to do that long term. You can't do intermittent fasting for 5 days and then eat throughout the whole day. Here with the calorie shifting diet, you have 4 days of low calories, 5th day normal, and that cycle, so you can look forward to that. So, in conclusion, any kind of diet should ideally be a change in behavior modification. If you're more comfortable doing an intermittent fasting diet, you know that you don't want to be counting calories, you know that you are okay eating a certain window of time, intermittent fasting is right for you. On the other hand, if you don't want to be sitting there looking at the time, worried that you missed your window of eating and now you have to starve till the next day, then calorie shifting diet may be a really good option for you. You're able to eat 4 days of low calories, 5th day is normal, and continue that cycle, and your metabolism doesn't go down in the basement, but stays relatively the same as to prior you going on the diet. I hope this was helpful. Take care.